The Thunder Bay Health Coalition is also a vocal critic of the legislation and is planning to continue to push back against the province. This all comes as a local medical clinic has implemented a membership program, forcing patients to pay annual or monthly fees to access services. Vasilios Bellos has the story.
The passing of Bill-60 on Monday came with a controversy, with Thunder Bay's local health coalition ready to push back.
We have a public Medicare system in Canada that we are so proud of, and the Doug Ford government is basically eliminating it, whatever is left of it.
Co-chair Jules Tupker has been a harsh advocate leading up to the passing of Bill-60 and says those efforts will continue. The Ontario Health Coalition has begun a citizen-run referendum against the bill, which allows more private clinics to offer some publicly funded surgeries. The referendum has already amassed more than 70,000 votes online. Those and other ballots accumulated throughout May are planned to be delivered to Queen's Park at the end of the month. While any number of ballots cast does not force the province to take a step back on Bill-60, Tupker believes this would still send a strong message.
The government wants to continue with that process. They're going to end up paying for it. At the end of the day, they have the right to implement it because they have majority in the legislature. But at the end of the day, they have to get reelected. And I'll tell you right now, for the next 3 years, we're going to continue telling people this is what Doug Ford has done. He has eliminated public hospitals, and he's going to end up closing public hospitals.
The passing of Bill-60 comes as just last week, a clinic on East Victoria Avenue began a membership program. Fort W Medical Clinic says it's charging patients $100 a year or $10 a month to access services from their nurse practitioners. The clinic is citing increased costs in providing medical services and the fact they receive no government or OHIP funding.
The healthcare funding in Ontario is not up to snuff. And these nurse practitioners that are working at the clinic now, at the Fort W clinic, they can't afford to pay the nurse practitioners. They need them because we know that there's not enough doctors.
The owner of Fort W Medical Clinic wasn't able to speak on camera regarding their new membership fees. Vasilios Bellos, TBT News.